Well, starting today, people in Contra Costa County who are 16 and older are now eligible to make appointments for a vaccine shot at the Oakland Coliseum.
The news comes just days before California is set to expand eligibility to folks who are 16 and up to actually receive the vaccine. Joining us now to talk about the expansion is Contra Costa County's Deputy Health Director, Dr. Ori Zaveli. Dr. Zaveli, thanks so much for spending time with us here on KRON 4 News at 8 o'clock this Saturday night.
Thank you for having me.
All right, first question is, you guys are now letting folks 16 and up join in the group with those expansions. Are there enough vaccines? Will you have enough vaccines to handle the demand?
We will. We actually opened up to the 16 and up group almost 2 weeks ago, so we have gotten through that initial deluge, and now we're at pretty much a steady state. So if someone comes onto our website at cchealth.org and requests a vaccination, generally within 24 to 48 hours, we will send them a ticket to make an appointment, and they'll usually get their appointment within the next 5 to 7 days. And what's really exciting is that starting this Monday at the Oakland Coliseum, there will be access for Contra Costa patients as well. So to sign up for that, you either go to cchealth.org or go to myturn.ca.gov and sign up there, and you should be getting an appointment pretty quickly. Yes, our supply is keeping up. We had a little bit of a hiccup with the Johnson & Johnson vaccine supply due to the factory issues back east, but we're able to move some things around and use some other vaccination types, and we think we're going to be okay.
So what does adding the Oakland Coliseum site do to getting people vaccinated in Contra Costa County?
Well, it adds about 4,000 vaccines a day, which are shared between Contra Costa and Alameda counties both, in the Coliseum itself. Plus, it brings a few mobile teams to Contra Costa County and Alameda counties as well to vaccinate more. So all in all, we're adding about 6,000 vaccines a day, which is fantastic. It will really help us keep up with the demand. A lot of people have been waiting. Now is the time to express your interest and come in and get vaccinated. We want to get to that community immunity level, and we're making headway. So we're really pleased to have the Coliseum site and the access through MyTurn for Contra Costa population.
That site was supposed to close tomorrow, but is going to be expanded at least for another 4 weeks. Can you talk a little bit about what the partnership will be like between you and Alameda County and what it took, just kind of the efforts behind the scene to keep that mass vaccination site open at the Coliseum?
Sure. Yeah, it was a lot of late night talks to get the deal going, and I have to give our thanks to our partners in Alameda County and our partners at the state, which really we all came together. The state is contributing a lot of vaccine. We are, as well as Alameda County. A lot of state personnel is staying on from their deployment. So we're really grateful to them. And it really was a lot of goodwill and just a desire to get both of our county populations vaccinated. The Bay Area has been amongst the leaders in the state in getting our population vaccinated, and this was another example of good collaboration between different government entities for the health of our population.
So it sounds like there's enough supply. There's definitely enough sites now. More people are eligible, 16 and older in Contra Costa County. We're hearing this term, herd immunity. What's the target date for Contra Costa County and even the Bay Area for reaching that point?
You know, we initially set out a goal to reach 1 million doses by Independence Day, and we've exceeded our expectations. Then we push it forward to Memorial Day, and now we think we'll be at 1 million doses in arms before the end of the month. We're already over 820,000 doses put in arms. You know, herd immunity is sort of a fuzzy level. Most experts say it's about 75 or 80%. I would like to get there by summer. It will also help if and when the vaccines are authorized for the younger groups, the age 12 to 16. It will help us get even more people vaccinated before the next school year. So I'm hoping that sometime this summer we really get there. But we're already seeing a lot of the benefits. We're seeing fewer infections, many fewer people dying. Our hospitals have a lot more space in them, so we're really happy with the progress so far.
820,000 folks in Contra Costa County, more than a third of the entire county now vaccinated. Can you talk a little bit about what the message is that has allowed Contra Costa to be so successful with getting so many folks vaccinated ahead of the timetable that you had initially had?
I think we've had really great partnership with a lot of our nonprofits and community-based organizations. We've gone to nursing homes, low-income senior housing. We've really had a no wrong door approach to getting vaccinated. We've had some private provider groups. We've worked with Kaiser, like Clinica, Lifelong, just a lot of the partners that we had. John Muir's been a great partner for us. So we really just feel like set a lot of sites up, really make it low barrier to coming in. Focus on the people in the lowest HPI communities and as well as our elders to get them vaccinated first. If you look at our over 75-year-olds, over 96% are already vaccinated, which is fantastic. Every one of those people vaccinated is another life saved.
And why is it when after people get the second shot, they start to feel sick, and the first shot they feel fine?
Yeah, we have seen that. The more times people have symptoms after the second shot, it's because the first shot really primes your immune system. It's showing you, hey, look at this, get ready for it, prepare if you see it again. And then when you get it the second time, it's like a booster, but your immune system is already ready to go. And part of that immune response is feeling a little sick sometimes, maybe having a low-grade fever, muscle aches, lethargy. So it's a good sign that your immune system is working. We do see that those side effects more in the younger population than the older. So, but don't take it as a bad thing. It's a sign that the vaccine is working, that your immunity is developing.
You may not feel good in the moment, but just know that it's actually working.
That's right.
A lot of folks need to hear that warning tonight. Dr. Ori Zaveli, thanks so much for joining us tonight. We greatly appreciate it, and along with the advice and all the information.
Thank you for having me. And again, to sign up, go to myturn.ca.gov or go to cchealth.org. You can sign up at either place, and you should be able to get an appointment quickly.
And we have all of those links on our website as well at cron4.com.
Thank you.